Do you know how much impact patient noncompliance is having on your patients and your hospital? In the US alone, failure to take prescribed medications costs over $100 billion a year in preventable readmissions. Finally, there's a medication system designed to help reduce these unnecessary costs. Introducing QRX, the first interactive medication management system on the nation's first wireless network dedicated to machine-to-machine communication. This is Jean. Jean is 70 years old and has been hospitalized with congestive heart failure. Today, she's being discharged from the hospital. Jean's doctor has prescribed several medications that are critical to her recovery. If Jean gets confused or forgets to take her medication, she could likely end up back in the hospital. If Jean comes back to the hospital within 30 days of her discharge, not only will it not be good for Jean, it also won't be good for the hospital since Medicare may withhold reimbursement. Let's take a look at how QRX is set up. QRX works with standard prescription bottles, which are easy for the pharmacist, case manager, or patient caregiver to load, and are familiar to patients who may want to reference the prescription label. Once QRX goes home with Jean, there is something she'll need to do. She'll need to plug it in. It's that simple. Jean doesn't need to pair QRX with a smartphone or her home internet because it connects directly to the internet as soon as it's plugged in. This also means Jean won't need to worry about sharing personal information with her internet or cell phone providers. Here's how QRX works. The system has been designed to respond to Jean's pre-programmed medicine schedule. Jean is scheduled to take 3 medications every day at 9 a.m. When her dose is ready, QRX will notify Jean with audio or visual alerts, or both. All Jean needs to do is touch the screen as directed, and her medicines will be dispensed to her one at a time. If Jean is not near her QRX or forgets to take her 9 a.m. dose for any reason, she'll start to receive remote reminders on either her home phone or mobile phone if she has one. If Jean continues to ignore these alerts, a caregiver or family member will start to receive alert messages. As an additional safeguard, your hospital staff will be able to see Jean's non-compliance in time to intervene and get Jean back on track. Preventable readmissions are a serious and expensive challenge. QRX helps your hospital tackle that challenge by ensuring better patient compliance.